Everyone. We'll be getting started in a moment. Not seeing the screensaver yet, but I hope you in the audience are seeing that. As everyone's walking through the virtual doors to the Zoom room, we'll be getting started as people arrive here. Welcome. My name is Rick Page. I'm Dean of the Larner College of Medicine, and I'm so pleased to welcome you today to another edition of Off the Charts. Today I'm joined by Dean Christa Zehle, who is going to be talking with us now for our 7th edition of the periodic webinar series Off the Chart, where we highlight individuals and items of interest here at the Larner College of Medicine. And for all of you today joining us, if you look at the Zoom screen, you'll see a Q&A button there. Please go ahead and if questions come to you anytime during the session today, just go ahead and put those in, and we'll be monitoring those, and we will get to any of the questions that we're able to get to during this session. I want to make note that a number of our alumni attend these webinars, and we're so grateful for that. And we're so grateful to our alumni in general. The Larner College of Medicine is renowned for having among the most involved group of alumni of all the medical schools in the United States. You are really inspiring to us. And the fact that you are active still after graduation with the college and supporting our missions provide support for the medical students, some of whom we'll be talking about today. Now, improving medical student education and improving interprofessional education and collaborative practice, as well as meaningful experiences in the education realm, has been the career focus of our guest today, Dr. Christa Zehle. Since January 2019, Dr. Zehle has served in a role as Senior Associate Dean for Medical Education. In April 2021, she was also appointed Director of Education for the UVM Health Network. She earned her bachelor's degree from Trinity College and is an alumna of our college, having earned her medical degree in 1999. She then took her residency at the University of Rochester, where she served as chief resident. In 2003, we were very fortunate to have her return to Burlington as an assistant professor of pediatrics and to launch the then what was new and relatively innovative pediatric hospitalist service here at the UVM Medical Center. She was promoted to associate professor in 2011 and to professor in 2022. In 2012, Dean Zehle was named Associate Dean for Students, and she served in this role until January 2019, where she became Interim Senior Associate Dean for Medical Education. And in March of 2020, after a national search, she was named to her current position as Senior Associate Dean. She's a sought-after mentor for medical students and residents and has received numerous awards for her teaching. She's a master teacher in our own teaching academy, a member of the Alpha Omega Alpha Honor Medical Society and the Gold Humanism Medical Honor Society. She serves as a fellow of the American Academy of Pediatrics, is a member of the American Medical Association, and has been active in the group on educational affairs and student affairs for the AAMC. Among Dr. Zehle's many honors are the 2014 Early Achievement Alumni Award from the UVM Medical Alumni Association and the 2012 Leonard Tao Humanism in Medicine Faculty Award. She's a key member of the college's Liaison Committee on Medical Education Accreditation Administrative Team, or as we fondly refer to it, the LCME. Offered partnerships among the college's medical education leadership team, the Office of Diversity and Inclusion, the Teaching Academy, and the Active Learning Team to increase educational opportunities and to assure that the college remains at the forefront of delivery of innovative medical education. Wow, what a history. Dean Zehle, Christa, well, you're a valued colleague to me. Soon after I arrived, you ascended to this role, and we've been working together now for over 5 years. Now it's really my pleasure to welcome you to Off the Charts.
Thank you, Rick, for this wonderful opportunity.
So we have a number of questions, and as I mentioned to the audience, we will be asking for your questions. But I want to start off just kind of questions that was interested in, and others I'm sure will be as well. Now, what made you originally decide to become a physician and then a pediatrician?
Well, thank you for that question. It's actually a story that I love to tell our students who are trying to decide what to do with their career. First off, I'm extremely grateful to my parents who are immigrants to this country and made sure that I and my sisters had the opportunity to pursue education. And then I've always really enjoyed working with children, did a lot of activities in college and did a lot of babysitting as well growing up. And I actually did a lot of babysitting for a family and was a nanny during summer vacations for them. And he, Dr. David Stifler, was a pediatrician and has been my mentor for pursuing medicine. So that's how I kind of got the idea of medicine and really enjoyed my science courses and then decided to pursue it.
And then following up on that, you became a pediatrician. Was it the babysitting that inspired you originally, or the fact that he was a pediatrician, or what?
Yeah, I think it was a mixture probably of both of those. Actually, in medical school, so prior to that, when I was nanny summer and was staying with the Stiflers one summer, we had a teenager who they were vacationing on an island in Maine, and the teenager kind of busted up their knee, ATVing around the island, and came to Dr. Stifler's home to get repaired, so to say. And initially they were like, you probably don't want to see this. And I found it really fascinating and really interesting. It was like, oh, I can combine my interest in science and in kids together and serve as a pediatrician. So that was initially my thought. When I was in medical school, I actually really enjoyed pediatrics, obstetrics and gynecology, family medicine, and med peds. And if we look across all of those, they all have kids, the common denominator. And so it made sense that that was the career that I wanted to choose, and I've never looked back. I've really loved being a pediatrician and practicing pediatrics.
And you were really on the forefront in hospital medicine. And what was it that attracted you to that? Because if anything, you probably imprinted on outpatient pediatricians or pediatricians who did both inpatient and outpatient care. And nowadays, certainly in internal medicine, it was already being established that the concept of a hospitalist was there. But what was it that attracted you to staying in the hospital primarily in your practice?
Yeah, hospitalist medicine really wasn't on my radar as a medical student at all. Just like you said, it didn't really, pediatric hospitalist medicine didn't really exist at the time. And when I was a resident, and actually initially I wanted to pursue rural kind of pediatric care. I had explored the National Health Service Corps and kind of providing care in rural Alaska. I had read an article about 2 pediatricians who did that, and that seemed really interesting. And during residency, I enjoyed my outpatient clinic, but I wasn't really passionate about my outpatient clinic. I really enjoyed the time that I spent in the hospital caring for the kids that were admitted to the hospital. And then I had the opportunity to serve as a chief resident and just had another year to kind of explore what I wanted to do with my career. And that was the year that hospitalist medicine and pediatrics the conversation was just starting. And that's when I was applying for positions. So there were some programs that were just getting established, and I interviewed at some of those places, including the University of Utah, which was establishing its first pediatric hospitalist medicine program, and was new hospitalists to cover that service. And a few smaller community hospitals that were kind of doing that out of necessity. They needed someone to be in-house to care for the children, the pediatricians in the community who were coming to care for the inpatient patients. It was becoming more difficult for them. And then I had been in conversation with one of my great mentors, Dr. Lewis First, who was the chair of the department here. Right, and he had been a mentor of mine as a medical student, and then I kept in touch with him during my pediatric residency. And I said, do you think this is something we could explore here at the UVM Medical Center? So I received a phone call from him on a Friday night. I had the contract from the University of Utah in my hand, so I was just about to sign. And I was still in the office, and he called me, he said, I knew you'd be in the office. And then we started the conversation about what would a pediatric hospitalist service look like here in Vermont at the UVM Medical Center. I came home that weekend and met with him and met with other faculty outpatient providers who had been covering the inpatient unit. And from there, pediatric hospitalist service was born.
Right. So you got your dream job.
It was my dream
Fast
job.
forward a decade or so, more, I guess, and I arrived in 2018. You were already well established and beloved in the dean's office at that time as associate dean for students. What originally attracted you to getting involved in the dean's office?
So I've always really enjoyed teaching, and like you said, the pediatric hospitalist job was my dream job. In addition to just combining everything I really enjoyed, it's also where I grew up and where my family is, and I had the opportunity to come home, and that was really important to me. I've always loved to learn, and so I've always also loved to teach. And when I came back and served as the inpatient attending as a pediatric hospitalist, I was working with so many learners. So I had all the medical students that rotated on the pediatric board. I was working with all the residents in the pediatric residency program, as well as family medicine residents that rotated through, and occasionally some residents from other specialties. We also had other learners, pharmacy learners, we had nursing students. It was just a really great environment to be in and to really cover a lot of clinical education. And I always feel like I learned just as much from the learners as hopefully I'm teaching them. And so it's just a really natural environment for me. And then I saw the advertisement through the faculty listserv that the Dean for Students job was open. And I was a little bit surprised by that because my predecessor in the position, Dr. Scott Waterman, I felt like he had recently took on that position. My Dean for Students, Dean Margaret Sproul, who probably a lot of people in the audience knew as well, had served in that role, I think, for 19 or 20 years. So I was like, oh, I wasn't quite thinking about it at that time, but decided to meet with him. And also one of my pediatric colleagues, Dr. Jan Gallant, a pediatric radiologist, was already then in the admissions office, and I had served on the admissions committee. So I reached out to Jan and said, tell me a little bit more about this position. And it just sounded like a really exciting opportunity to return to the college and to work with medical students who are pursuing their education and selecting their career paths.
So as originally an alumna and now senior associate dean, still an alumna, you know this institution about as well as anybody around. As you step back for a minute and think about the Larner College of Medicine, what do you think distinguishes our college from others?
Well, we're one of the oldest existing medical schools, and we have a really nice, rich history. And I think one of the things that I've been really impressed about is that we're the only medical school in a small rural state, but we can accomplish so much in our research, in our education, and in our clinical care. We have faculty, staff, and students who are on the national scene, on the international scene. And so I've always been impressed with what we're able to do here as a smaller institution in a small rural state. And I think a lot of that has to do with our geographic proximity to everything. So the College of Medicine is located on the university campus. It's adjacent to one of our largest clinical affiliates, the UVM Medical Center, and now the UVM Health Network. And we are very close in proximity to our state house. So there's the opportunities and experiences that our students can have, which I don't think is always the case at other schools, at other medical schools. So our students can get really involved in research, can be really involved in public health initiatives. They can travel to the State House and be involved in advocacy. And they can also just pick up the phone or have a meeting with faculty or senior leadership, such as yourself. So I think that is really a wonderful strength of the Larner College of Medicine.
Yeah, you know, you mentioned you're old. The seventh oldest medical school in the country, and we can be proud of that history. We celebrated last year. Many people tuning in know that 2023 was the bicentennial of our first graduating class. You're describing some of the things that struck me when I first started looking at this position as well. And you had the good fortune of coming up through this system. I came from outside and was struck by the culture here and the collegiality and the fact that so much gets done in a medical school by population, one of the two smallest states in the United States. Pretty amazing place. Now, every place has challenges, and your involvement in medical education and both nationally now as well as locally has had you at the front lines of the medical curriculum and how we deliver medical education to our students. And I should mention that while we are one of the oldest medical schools in the United States, the fact of the matter is we are known for innovative curricular activities. I remember hearing on NPR before I ever dreamed I'd be here that UVM got rid of lectures. How can you do that? Well, it's active learning and it's part of our DNA now. But from your standpoint, what have you found as the greatest challenges as we're trying to put a curriculum together for our medical students, or to flip the perspective, what are the opportunities in terms of providing education to doctors to be over 4 years now here in 2024?
Well, I think you mentioned a really important point that we've really had the opportunity to be very innovative, and that's due to all the senior leaders in medical education that came before me. And I think, you know, stepping into this position, the actual role I stepped into on March 11th, 2020, which is the day that our president made the announcement that we were going remote. So that was kind of an unexpected challenge. Just how do you deliver medical education in a remote environment? And we have a great team of educators and medical education leaders here at the College of Medicine, so we were able to navigate that. But aside from kind of the challenges of a COVID pandemic, I think one of the things that's really difficult in medical education is the volume of information and how our students access that information. Now there's, you know, with technology and with social media and with the opportunity of what to access on the web, you can access information in a lot of different ways. And medical information, it's just increased exponentially.
Yeah.
And so our students are faced with lots of different ways to obtain the information. And sometimes it's difficult to know how you learn best and how to learn the information best. So I think when we're looking at our curriculum, we have a great integrated curriculum, and that was established in the early 2000s. And I think that's a really helpful way to learn the foundational information. And then clinical skills are really essential to learn in the clinical environment. That's where COVID played a kind of unique twist. And so when our medical curriculum committee meets, we're constantly looking at what material, what information are we trying to pass on to the students? How are we passing it on? And are we being inefficient in the delivery of our curriculum and not redundant? So it's constantly creating that balance.
Yeah, the experience with COVID was amazing. I remember as we were first facing the idea of match day, pivoting and breaking just so many hearts that we were, 2 weeks in advance, you and I and others made the decision that we needed to do a fully remote match and even zoom in to every single student as they went through it. And I'm tremendously proud of that. And I'm looking around at some people that the audience can't see that were involved in making those decisions and making it work for our students. now we, as opposed to the group that's graduating this year, who you and I greeted with full PPE on, in little pods where and this is instead of a big auditorium, where now we greet the new medical students, and we went in little groups of about a dozen, I guess it was. And now we've come back from that largely, and are there ever any silver linings to what we've been through in terms of COVID, and how did that change perhaps how we deliver medical education?
Yeah, I always like to look for the opportunities. I think that there are always some silver linings, and you can always learn from the things that you're doing. Our students are really incredible. I mean, we have amazing students in that class of 2020 adapted in a remarkable way. And I know that was kind of a difficult spring and ending to their medical education. But again, they adapted, and the staff and the faculty adapted. And I think we still had a really unique creative match day. And we hope to be able to celebrate more in the future when we don't have the COVID experience. I think also some of the other silver linings were really a way to achieve more equity in medical education. So during that time, away rotations really were canceled for fourth-year students who are going away to experience their specialty at other institutions. Medical school interviews went to virtual interviews, residency interviews went to virtual interviews, and some of those things have remained in place. So medical school admissions remain virtual, and that really allows all applicants wanting to pursue medical school to have kind of an equal opportunity without the significant expense of needing to travel to various schools to interview. The away rotations, they've come back, but it did give us an opportunity to determine, are they needed to the degree that they were occurring before. And then residency interviews, some programs and some institutions have returned to in-person, but I would say the majority have really remained virtual. And again, that just provides equity for students across the nation to be able to interview for residency without some of the financial challenges. Our students were spending anywhere from $2,000 up to $12,000 just for interviewing alone. So that's a significant reduction in cost for them. I think another area that was an opportunity was telehealth. And for medical education, our team, especially Kate Nicholas in the simulation lab and many of our other medical educators, they were able to pivot really quickly and put together a 2-week course for students on telehealth. And that has continued today as an elective for students that they can take. And I think for providing healthcare, we really were struggling getting telehealth established as a way to deliver care. And we had to pivot quickly and do that. And that has now remained. There's a lot of telehealth visits that happen, and that can be really valuable in a rural state where sometimes access to care is limited. So I think that was another area where we really benefited from an otherwise really difficult situation.
Yeah. Whether to continue gross anatomy with cadavers and dissection, and many in our audience would remember their experience in the anatomy lab, and we were committed to maintaining and are committed to maintaining the dissection. But during COVID, because we were limited in how many people could be in the room at the same time, we augmented with some electronic. We bought some more iPads to augment the experience, and now we have a true hybrid where we still have the traditional prosection, if you will, combined with that additional technology. I want to shift gears a little bit and mention that med school's always been tough, and physicians and mental health challenges has been a reality for many years. It seems like more students are affected, and what can you share with us in how our college is addressing issues of mental health for medical students?
Yeah, I think, as you mentioned, medical school has always, been difficult. And I think there's been mental health issues among medical students, you know, that's always existed. One of the things that I see, today that's kind of contributing to it is I think there's additional stressors, including societal stressors. So, medical student remains difficult. Our students then have to deal with some really complex societal and global issues, and addressing other things such as racism and the challenges that are in our environment. So it's really important to ensure that our students have access to mental health care and access to mental health resources. And you know, for me, as I mentioned, it has always existed. One of my dear close friends from medical school actually took her own life after residency, after she had failed a national certification exam. And so that experience for me has always remained at the forefront of what I do in medical education. And I'm constantly wanting to support our students, one, to say, you know, a national certified exam is only an exam. It doesn't define who you are. And also make sure that we have really strong mental health services, really strong supports for our students. So even before I joined the Office of Medical Student Education, or now the Office of Medical Education, we had a clinical psychologist who was providing care for our students, not necessarily direct kind of patient care, but being there as a resource for students and providing them with referrals. We also had a faculty member who had established the wellness committee, and that was already in existence. That's a committee where we have student electives from every class. Now we have 5 student electives, 4 from the Vermont campus, 1 from the Connecticut campus, for each class. And then they have faculty advisors who also serve on that committee. Dr. Lee Rosen is our director of student wellbeing, so he supports that committee. And then we have an assistant director for medical student wellbeing, Dr. Leanne Holterman. So we have a pretty robust team that supports medical student wellness, and they work very closely with the university resources, such as CAPS, which is the Counseling and Psychological Services Program at UVM. And recently, we've also been grateful for a donation by alumni. So we have 2 established endowments that are specifically focused on medical student well-being. One endowment was to address resilience amongst our medical students, and one endowment was to really reduce the stigma of mental health amongst medical students. So all of that combined, one with our resources for medical student well-being, along with some endowments from alumni that we're really grateful for, that have allowed us, by being an endowment, it allows us to do annual programming. So we've been able to put together some cognitive behavioral therapy sessions for students, and some other programming that's been really valuable. And nationally, there's a lot of work being done as well. So I had the opportunity to serve on the AAMC Group on Student Affairs Medical Student Wellbeing Working Group. And there we've been able to put forth some guidelines for all medical schools, as well as kind of establish a model for medical student well-being that really looks at the learning environment, the efficiency of learning, and personal resilience as a way to approach your own mental health care while in medical school.
It's so important. And thank you for highlighting the generosity of alumni. 2 different independent alumni had a passion around medical student wellness and mental health, and gave generously to our college in support in perpetuity for our medical students. Speaking of wellness, kind of upstream of any other mental health issues is fitness and wellness. And why don't you share with the audience the exciting things that are happening, thanks to, in part, donations from our alumni and certainly our namesake alumnus, Dr. Larner.
Yeah, this is really exciting what we've been able to put forth. Starting as a dean for students, it became really apparent. Again, I mentioned we're geographically really close to our university, and we have a lot of resources available to students at the university. But one thing that students came forward about was just access to the gym, and the fitness center was pretty difficult for them. It's not too far away, but when you're in a busy medical education curriculum, or you're in a clinical site, at a clinical site or in a clinical experience, it's really hard to get away to go to the gym. And the hours also weren't always conducive to our medical student schedules. So over the past 10 years, we've really been creative and tried to look at a lot of different options. Could we extend the hours at the main campus gym? Could we figure out easier transportation for students? There's a few other gyms on campus. Could we give our students access to those gyms? And we haven't really been able to successfully come up with solutions for the concerns that our students had brought forward. So thank you to you and to generous donations by alumni and really strong advocacy around this. We have been able to identify funds to build a fitness and wellness center right here on campus in the given building. One way to do that was to upgrade their student lounge. So their student lounge was looking a bit tired, I think, over the years. And I think you in particular did not want them to be without access to a student lounge. And so with the help of facilities and Eric Gagnon, director of facilities, we were able to identify another location adjacent to the current student lounge, move the student lounge, rebuild the student lounge with a lot of input from students and staff, and opened that this month. So February 5th, we had the ribbon cutting ceremony for our new student lounge located in a new site. I think the moment it opened, the old student lounge was decommissioned and construction began for the building of a fitness and wellness center, which will have 3 showers and changing rooms. That's big. We've had lots of feedback from students that we're a campus that focuses on wellness and activity, but we don't have any showers really for them to access. So it's hard to be at school and work out and then take a shower. So 3 showers, a space for dance and yoga, and then lots of different equipment to either use a treadmill or a rowing machine or other free weights as well. And I hear that late April, early May is when we'll have the ribbon cutting event for that. So I think this, there's many alumni out there who put forth proposals and gave feedback. And I know we weren't able to have this gym open in time for them, but I want everybody to know it's happening. We have the new student lounge, and the gym is going to open this semester. And I think that's just really going to help support our students be as well as they can while being in a rigorous medical curriculum.
Yeah, absolutely. Yeah, it's really exciting for any watching today. When you come visit, I hope you'll take an opportunity to see what we built. It is beautiful, and there's a ping pong table if you want to take on some of the students who are pretty good. We've just got a few more minutes for the questions that I've got for you, and then we're going to be opening up to anybody who wants to ask a question. If anybody joined after I introduced today's session, there's a Q&A button. Please go ahead and put in any questions you have, and we'll get to all of those that we're able to today. Now, the LCME I mentioned is our accrediting body, and we went through a successful reaccreditation. The Larner College of Medicine is accredited fully, got a full 8 years from 2021 till 2029, although 2029 is getting closer and closer. Can you just briefly tell the audience some of the highlights of that experience?
Yes, so the LCME, also known as the Liaison Committee on Medical Education, is a really important component to ensure standardization of medical education across all levels. And It's a real rigorous process. There are 12 standards, and within those 12 standards, there are 93 elements that they're sure that you're in compliance. Previously, they had focused on strengths and then had a ranking for where you might be in those elements. They have since moved to really focusing on your satisfactory, or you're satisfactory with monitoring, or you're unsatisfactory. And anything that's satisfactory with monitoring or unsatisfactory, the LCME continues to monitor that until they identify that you're satisfactory with those elements. And every 8 years, medical schools go through a review by the LCME. And I had the opportunity to participate in one as a dean for students previously. And then we had our most recent one in 2021, and we were really grateful to receive full 8-year accreditation. That's not the case for all schools, including some really well-known competitive medical schools. So we were grateful for the results that we had. We were found to be satisfactory in 83 out of the 92 elements. And we really felt like in the remaining elements where we were either satisfactory with monitoring or unsatisfactory, that was great feedback for us to be able to identify where we could improve and where we could be better. And so while we focus on all 93 elements, certainly areas that have been identified as needing additional focus, we have paid a little closer attention to those. Another thing that I think has really changed in the accreditation process is they've moved away from kind of this 8-year cycle where you feel like you have a sprint kind of leading up to it, and looking more at a continuous process, really asking medical schools to establish a continuous quality improvement committee, which we have done here. And a committee such as that is really asking you to look at all areas on a continual basis so that you can constantly identify where you might need to put additional focus before you're preparing for your 8-year review. So I am a fan and really appreciate the CQI, or continuous quality improvement process. It feels a little bit more natural instead of having to rush and focus on these specific areas. The areas that we are currently focusing on as a result of our 2021 review are in research, making sure medical students have access and support for research in some of our curriculum, and then in student relaxation space, as we've talked about, especially in the clinical environment, as well as career advising. So those are areas where we're focusing.
Just want to briefly mention, because people ask me about, you and I and our college is committed to allowing our students to become whatever they want to be. If they want to hang up a shingle as a primary care provider, if they want to become an academic neurosurgeon, or God forbid, a cardiac electrophysiologist or pediatric hospitalist, to do anything, but also to become master educators, to be involved in public health, to be involved in research. Can you just briefly mention the opportunities for research and public health exposure in the college now?
Yes, we certainly have seen an increase in interest in research and public health activities, especially as many curriculums are kind of shifting away from the competitive honors assessment to a pass-fail curriculum, as well as national standard exams that have moved to pass-fail. So I feel like we have a lot of opportunities here. One thing specifically about public health is that we've incorporated that, and have for years, to be part of our required curriculum. And that is a course that's led by Dr. Jan Carney, our Associate Dean for Public Health, where students have the opportunity to work in small groups and work with community organizations and agencies to conduct a public health project, and then develop a poster that's then displayed at a poster session for the college to really demonstrate what they've learned and how they've had an impact on our local community. So that is something that all medical students have the opportunity to do. In addition to that, we have a director of medical student research, which is Dr. Renee Stapleton, And we put that into place back in 2016, but increased her percent effort as our director of medical student research, just because of the significant increase in students that have wanted to participate in research. And we're also grateful to our alumni for alumni donations to support our summer research fellowship, where we now have over 40 students every summer participating in research, most of it locally with local faculty, some at other institutions, but that's been a great program that occurs between the summer of first and second year. And that too now has an expectation that students develop a poster and present that poster at the summer research fellowship poster session in the fall. So lots of opportunities.
So every student has the opportunity. Half of them now participate in meaningful research experiences. Last thing I just want to ask you to update us on and maybe put a plug in for this year's event is the match, which comes up next month. Tell us about how the match is done now and what's going to happen here at the Larner College of Medicine.
So match day, which I like to say is the best day of the year in medical education, is really what our students are striving for as they go through their medical education. Is really the culmination of all their hard work. And it's really a day to celebrate their accomplishments and lets them know where they're going on to for their graduate medical education training. It's also a day of celebration for our staff and our faculty, because they put in and dedicate so much time to supporting our students and getting them to the next chapter in their lives or the next phase of their education. So an important day to celebrate. We again have amazing students who do incredibly well in the match. We have students entering diverse specialties, and we still have a large percentage where typically 40% of our students are pursuing primary care. And we really take that opportunity to turn it into a celebration. Our students pick a fun theme. And so this year's theme for the class of 2024 is the disco theme, which I think will be great. And
a bit terrifying, I might say, but great.
There'll be some great outfits, Rick. Yeah. I'm looking forward to seeing what you're wearing.
That being said, it really is an amazing event, and in the chat we'll put a connection to, so if people want to live stream, we have families live streaming all over the world. Our President Garamella joined us last year, and a couple things struck me. For one is, I think he saw this as an event like no other he'd been to. He also was struck by the very strange thing that is common to us, is that in March, you find out where you're going to be working and living through this computer generated program, and you're informed and you tell the world all at the same time. So it's a kind of crazy thing, but it is fun. I've been in a lot of match days. None is like the Larner College of Medicine. So I could keep asking you questions, but I know the audience has questions, and we're really fortunate that Dan Suter, our Associate Director of Alumni Relations, is here. He's been monitoring the chat. Dan, what questions do you have for us?
Thank you so much, Dean Page and Zehle. Speaking of algorithms, how are you thinking about AI in medical education and deploying it on an even keel so we do not become too algorithm driven while ignoring medical judgment?
That's a great question. AI stands for a lot of different things in medical education, but I'm going to assume this question is about artificial intelligence. And this is really a hot topic in medical education right now. The AAMC actually starting in January, so that's the Association of American Medical Colleges starting in January, is leading a series of webinars on artificial intelligence. And prior to that, our medical education leadership team was already exploring this concept in various areas of medical education. One area it specifically is in the clinical simulation lab. We have a state-of-the-art clinical simulation lab, and students participate in over 94 clinical sim experiences during medical school. And so it was really looking at an artificial intelligence or virtual reality play a role. And then we also have a group of students who are really interested in exploring how artificial intelligence can play a role in their medical education and in their curriculum. So in December, I believe, a group of students presented information to the foundation's curriculum subcommittee. So that's the basic science level of our curriculum, about how could artificial intelligence be incorporated. So currently what we're looking at is putting together a task force on artificial intelligence that will include our medical education faculty, as well as our students who are interested in this topic, and staff members, while we're monitoring the national information that's being provided through the Association of American Medical Colleges with their webinar. There have been conferences where this has been a main focus too. I know Dr. Kate Nicholas, who is the director of our clinical simulation lab, just attended a conference last month where every session was about artificial intelligence. And I think what you have to do is really look at risk benefits, right? We do that a lot in medicine, exploring kind of the risk benefits. So looking at really where are the benefits of artificial intelligence and how can we incorporate that into the delivery of medical education, and making sure that we are monitoring the risks and therefore don't have it take over an area where you still really need human involvement to provide that and deliver that education.
Yeah, who knows what's going to happen. It's very exciting. But I was going to also mention algorithms, and I think I can speak for our college in saying that algorithms or guidelines are very important. We need to know them, we need to understand them. We also, it's an art and science to medicine. For example, this week I saw a patient who's close to 80, has atrial fibrillation, needs to be on a blood thinner, who rides horses. And that was a conversation that represents the art of medicine that we need to emphasize to our students as well, because you may have a guideline, you may have an algorithm, you need, when you're sitting with a patient, you need to identify what makes most sense for that patient and the passions that they have. Dan, other questions?
Yeah, thank you. Changing gears, can you please briefly discuss the Connecticut campus, including the outcomes and success for students who train?
Great. So we established a partnership with a hospital in Connecticut back in 2010. And that at the time was Danbury Hospital. And that relationship came about through faculty that were here at the time and provided us an opportunity to send some students outside of Chittenden County, because we want to make sure that there's enough learning experiences for all our students and not create a real sort of saturated environment for students. We had previously had a relationship with Maine Medical Center, and that was ending. And so really exploring other opportunities where we could send students for a different experience. Danbury, Connecticut has a different patient population, and really was providing our students additional opportunities. So for a number of years, it was a developing partnership that then evolved into having a regional branch campus in Connecticut. Meanwhile, Connecticut's healthcare organization was changing under the leadership of Dr. John Murphy. And so they had established a few other hospitals in the Connecticut area, and now are actually Nuvance Health Network. And we have a real wonderful partnership with the leadership there, as well as with our medical educators. So we have an assistant dean for students, Dr. Ellen Pulaga there, and an associate dean for medical education, Dr. John Rosen there. And we now send 35 students who make that decision when they matriculate to, or when they accept their offer to medical school, to go to the Connecticut campus. And they're here in Vermont for the foundations level of the curriculum, which is through March of their second year. And then they move to Connecticut to continue their clinical education at the Newlands campus in Connecticut. I believe there was a second part, metrics outcomes. So the opportunities and the experiences are different at the Connecticut campus. However, a real important piece is that they're comparable to the experiences in Vermont. And that's actually just kind of common sense, but also required by the LCMER accrediting body. So we ensure that the experiences they have are compatible and are We have on-site clerkship directors for the clerkship curriculum, and they communicate very closely with our Vermont clerkship directors. Certain things are centralized here to ensure that it's comparable, and then other things are developed specifically there at the Connecticut campus based on the strengths and the opportunities that exist there. Our students have had great outcomes from the Connecticut campus and have really the same opportunities to pursue specialties across all specialties. And we work closely if there's something specific that a student wants to participate in. We work closely with our Connecticut team to make sure that they have the opportunities and the experiences that they need to pursue the specialty of their choice.
Other questions, Dan?
Sure. On the topic of wellness, some of the research says that modeling wellness is critical to support well-being in your student community. How do you support your faculty and staff to model supportive health and well-being practices? How do you support your own mental health and well-being?
Excellent question. I think that's really important to emphasize that you can't ask certain things of your students and not be practicing it or engaging in it yourself. And that was something that Dean Page recognized as well. So we actually commissioned a mental health task force back in 2021 that was reporting directly to myself and Dean Page, and was chaired by the chair of the Department of Psychiatry, as well as Dr. Lee Rosen, our director for medical student wellbeing. And that was specifically to look at mental health, not just for medical students, but for graduate students, for staff, and for faculty. So we had members serving on that committee that could represent all of those various groups. And then the task force put together their recommendations and presented the information to Dean Page and to I. And we have since incorporated some of the information. I should also mention there was a group I forgot, in that we also that task force also looked at the mental health and well-being of the graduate medical education program here at the MDM Medical Center. So really trying to ensure that we were looking at the needs of everyone. And we identified that the resources and the supports for medical students were particularly strong already. Obviously, more work can always be done. But that graduate students and residents had access to less support and resources for mental health. So that was important for us to know, so we could foster some changes in that area. As far as I think the question also asked about my own health and well-being. I'm a firm believer that it's really important to select a career that you love and that you're passionate about. And through that, you're establishing wellness. So that's really important for me working with students. It's really important for them to find the career that they're passionate about, because clinical medicine does have long hours and does have holidays and weekends. And so you have to really love what you're doing to be able to make some of those compromises. And don't think you have to make the compromises all the time. But there are going to be times people's health is not scheduled Monday through Friday. So we have to, in our careers, be available to our patients at all times, and establishing a system that allows that without putting a lot of burden on clinicians. So for me, my own health and well-being, I have an incredible support system and always have. So my family is a huge part of my health and well-being. Both my parents and my sisters, and then my husband and my children. My husband's a stay-at-home dad, and I wouldn't be able to do what I do without his incredible support. And my children are incredibly supportive too. I recently, the pediatric department needed coverage for their resident retreat, and they were looking for somebody to do the night shift. And I don't typically do night shifts anymore. I still practice clinically, but I'm called like the weekend warrior. I do all my clinical work on the weekends so I can be admitted during the week. And I mentioned to the chief resident, I said, just so you know, I'm available in a pinch, but I don't, you know, if someone else wants to do it, please definitely give it to them. And so they put out the offer to all the faculty to put it out again. And then the chief president came back and said, can you do this? We really need you to do it. So I went to my husband and my kids and I said, they really need me to do this night shift. And, you know, is that something that you guys would be okay with? And there was some money offered, and so I did say I'll split the money amongst all of you for me to do the night shift. So that was a little bit of a carrot in the deal. But you know, it's important that I talked to them about it, and then it was really fun. I got to do a night shift, which I haven't done in a while, and play the role of a resident. So again, my family is a huge support. I also love the outdoors, and so for me, living in Vermont, I think it's one of the most beautiful place to live. So being near family and being in a state that has a lot of opportunities to get outside and to do activities that I really enjoy. And we have a puppy, and what could make you happier than having a puppy?
If there is one. Brief question, brief answer, and we promise we'll get to other questions if you put them in the chat. If you want to send an email to the original email you received telling you about on the charts, we'll try to get back to you. Yeah.
How do program directors evaluate students with pass-fail?
We're going to extend another hour. That's very briefly.
It's not going to be very brief, but a great question. I think program directors have asked that of medical schools. How do you want us to do it? And it's really looking at a holistic approach to your applicants. Medical school admissions has been doing a holistic review of applicants for a number of years now, and they actually have a lot of information and resources that can be really valuable to program directors. So I have always said admissions people get together with the GME program directors, because I think sharing of that information and what they've learned from taking a holistic approach to reviewing applicants could be so valuable to program directors. Technology has resulted in students being able to apply to way more programs than I ever applied to when I was applying to residency. And so programs have to make decisions that sometimes aren't based on what maybe previously they did. And so having scores for national certification exams was a nice way to screen out certain people. And that's something that isn't possible anymore. So a holistic review of applicants is really what's needed. And I think we have an example from medical school admissions to help guide program directors.
And I would honors they're all valuable, and the residency programs can work through that, as Dean Zehle said, through a holistic process to understand the qualifications and to determine who is the right fit for their program.
Yeah, and just to add to that, competency-based assessment is really the key too, so that you're assessing your medical students on their competencies, not based on a score. It's more equitable as well.
So with that, we come to the end of time. Thank you, Dean Zehle, Christa. Really an interesting look into your life, your perspective, and all that's going on in medical education here at our college. And I want to thank everyone who joined us today for this latest edition of Off the Charts. Please stay tuned for other opportunities moving forward. I hope everyone learned a lot today. I know I certainly did. When we close, we will be giving you the web address for Off the Charts. You can review this and look at other editions at your leisure. Also in the chat has been information about Match. It's a big day. It's coming up soon. We'd love you to join us either in person or online. And I look forward to visiting with those of you who are watching today sometime in the future. Please come visit us here in Burlington and other events that happen in and around. We always love it when our alumni and friends come and visit the campus. So on behalf of Dean Zehle and myself, thank you so much for joining us today. Stay well, stay safe, and we hope to see you the next time.
We are clear.